Hello, I'm Dr. Sandra Galura, Assistant Professor at the University of Central Florida, located in Orlando, Florida. Co-authors of this presentation are Dr. Joy Parchment, Assistant Professor, and Dr. Nora Wachowski, Professor, both affiliated with the University of Central Florida. This poster presentation focuses on the development of an evidence-based toolkit to support the transition of interim nurse managers. We know that critical, unfilled leadership vacancies threaten organizational outcomes and have led to increased reliance on interim nurse manager positions. Research has demonstrated most interim managers are employed by their organization, have some entry-level leadership experience, are satisfied with their role, and likely to pursue a career in nursing leadership as a result of their experience. Yet 22% report having no role preparation. The purpose of this project, therefore, was to develop an evidence-based toolkit to support the role transition and leadership development of interim nurse managers. This project was guided by the new nurse transition shock framework based on the work of Marlene Kramer and adapted for interim leadership transitions. In addition to reviewing the relevant literature and national standards and competencies, we conducted content analysis of an open-ended question asked as a part of a larger survey of interim nurse managers. The resulting toolkit is organized into 3 phases of transition spanning 1 year, a timeline based on the average reported tenure of interim nurse manager of 10 months. Within each phase, role-related activities are further divided into survival skills, consisting of activities that must be done within the recommended time frame to both support the transition of the interim manager while ensuring optimum functioning of the unit, and broaden and build skills, consisting of activities designed as deep dive activities to foster further leadership development. Phase 1, or the initial transition phase, consists of activities designed to support the interim manager during a time of exploring the unit's infrastructure, organizing and stabilizing the work environment. Phase 2 consists of activities to support the interim manager as he or she faces increased responsibilities and engages in more active decision-making. Phase 3 consists of activities to support the interim manager exiting or transitioning out of their role, with careful thought as to whether the interim manager will return to their prior role or accept a formal leadership position. This poster outlines the basic structure for an interim nurse manager toolkit, designed for use as a ready, quick reference for the individual assuming an interim role and for executive nurse leaders to help guide, support, mentor, coach, and develop their future leaders. Additional details describing activities listed in each phase of the toolkit can be obtained by contacting the authors through the QR code embedded in the poster. Thank you for your time.